Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's quickly compare the child versus the adult airway. So here under the child versus adult, first let's look at the child. So here under the child, the position is opposite to C3, C4. So it is opposite to the C3 and the C4. So what about the epiglottis? The epiglottis, if you see, it will be omega shape. So the epiglottis is omega shape. So first let's talk about the child and then compare it to that of the adult. So in epiglottis it is omega shaped and position is opposite to C3 and C4. Next, moving on to the thyroid. So here in terms of the thyroid cartilage, it is going to be flat. So the child is flat. Next, looking at the larynx, it is going to be conical. Next, when you look at the nervous part, it will be subglottis. Now moving on to the submucosal tissue, it is more and loose. Now let's look at the laryngeal cartilage. So what about the laryngeal cartilage? It is soft and collapsible. Now this is done about the child. Now let's compare to that of a normal adult. So here in the normal adult, the position will be opposite to C5 and C6. The epiglottis is going to be leaf shaped, whereas in terms of the child, it was omega shape. The thyroid cartilage in child, it was flat. Here it is going to be angulated. This is in terms of an adult. And larynx is going to be conical in the child, whereas the adult, it is going to be cylindrical larynx. The nervous part in terms of child is subglottis, and in adults it is subglottis and the epiglottis, subglottis and the glottis. Subglottis forming 70% and glottis forming 30%. Next, moving on to the submucosal tissue. Submucosal tissue. So here in the submucosal tissue, it is the adults, it is less and dense. It is less as well as it is dense. Next, moving on to the laryngeal cartilage. So this laryngeal cartilage, it is hard and ossified in terms of the adult. It is hard and it is ossified as well. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.